Good evening and welcome to the third webinar in the This Lead is Killing Us web series hosted by the Martingale Press Health Professions Division Library at Nova Southeastern University. A few housekeeping things before we begin. First, the session will be recorded and posted on our website, which I will share in just a moment. During the presentation, please make sure to remain muted, and there will be time at the end for questions. Feel free to enter your questions into the chat box as you think of them, and we will get to as many as possible during the Q&A session. This web series is based on the National Library of Medicine digital exhibit, This Lead is Killing Us, a history of citizens fighting lead poisoning in their communities. Guest curated by Dr. Richard Mizell from the University of Houston. The exhibit explores how citizens have confronted lead industries, housing authorities, and elected officials to protect their health against the dangers of lead poisoning. The goal of this companion web series is to raise awareness about lead poisoning and empower our communities to advocate for healthier places to live, learn, and work. We have created a website with a link to the free online exhibit, which includes images, photographs, and documents for you to explore. On the website, you will also find a list of virtual events and resources. You can access the website by visiting lib.nova.edu/lead. In the virtual events page, you will find information for all the events in our web series, such as date, time, description, and link to register or join. Our next event is on Tuesday, November 2nd at 12 p.m. And we will be adding our last event taking place on November 5th at 2 p.m. So please check the page often for any updates. On the page, you will also find links to the recordings once they have been posted. In the resources page, you will find information on lead poisoning, environmental health topics, and environmental justice. This evening, we're fortunate to have two presenters, Sudha Rajagopalan and Dr. Elizabeth Fernandez. I will first introduce Ms. Rajagopalan, and she will present, and then I will introduce Dr. Fernandez before her presentation begins. Sudha Rajagopalan is the Lead Poisoning Prevention Coordinator and epidemiologist at the Florida Department of Health. She has been involved in lead poisoning prevention since 2014. She oversees lead testing and tracking the occurrence of lead poisoning cases among children and adults across the state. As the program coordinator, she is responsible for the oversight of lead poisoning prevention and case management activities in each of the funded counties, as well as across the state. Ms. Rajagopalan has served in various epidemiological capacities at the department over the last 7 years, providing data and analytical support for chronic diseases such as breast, cervical, and colorectal, heavy metals such as mercury and arsenic, and environmental origins such as carbon monoxide and pesticide poisoning. So now I will pass it over to Ms. Rajagopalan.
Thank you so much, Daisy. Are you able to hear me okay?
Yes, we can hear you.
And just to confirm, you can see my slides, correct?
Yes.
Perfect. Thank you so much for that introduction. And good evening, everybody. And thank you for taking the time to be with us here this evening. And I, as Daisy mentioned, I'm Sudha Rajagopalan. I am the Lead Poisoning Prevention Coordinator for the state of Florida. And today I'm just going to give you a brief overview of how the program has been structured, how we operate across the state, and just some overview on how our statistics look for children less than 6 throughout the state. So this is just, if you look at this, it's just a program timeline, just shows how the lead poisoning prevention program evolved over the years. This program has been with the State Department of Health for a very long time. It has a very long history. And in 1992, lead poisoning became a notifiable disease in Florida, and the lead poisoning prevention program lead poisoning prevention program was established with a grant from the CDC. A statewide program was established between 3 county health departments, that is Miami-Dade County, Duval County, and Pinellas County in Florida, and the program concurrently received and sought independent funding from the CDC to operate childhood lead poisoning prevention programs. In 2001, the Florida ABLS, that is the Adult Blood Lead Epidemiology and Surveillance Program, was established, and it's a state-based surveillance program of laboratory-reported adult blood lead levels. The objective of the program is to build state capacity to initiate, expand, or improve adult blood lead surveillance programs, which can accurately measure trends in adult blood lead levels, and it can effectively intervene to prevent lead exposures. In 2003, the statewide Florida Childhood Lead Poisoning Prevention Program was created, and the state's lead poisoning funding scheme changed from 4 separate grants to one overarching cooperative agreement between the CDC and the Florida Department of Health. In 2006, the Lead Poisoning Prevention Screening and Education Act was passed and provided financial support from general revenue funds to support blood lead screening and to ensure proper medical management of lead-poisoned children. The LEAP-C was the first legislation in the state related to childhood lead poisoning screening, case management, and prevention. This act is covered by Florida Statutes 381.982 to 381.985. So under this act, the Florida Department of Health is required to establish a lead screening program and to establish the standard of care for lead poisoning case management. In 2011, unfortunately, the funding for the Childhood Lead Poisoning Prevention Program ended. And subsequently in 2013, funding for the ABLS, or the Adult Blood Lead Epidemiology and Surveillance Program, ended as well. In 2016, due to the adverse health effects of lead at low levels in children as well as adults, CDC proposed to lower the case definition from 10 micrograms to 5 micrograms. This blood lead level range has shown to have associated effects with hypertension, adverse effects on renal function, cognitive dysfunction, and adverse female reproductive outcomes. A 2013 CST publication recommended that individuals with blood lead levels of 5 micrograms per deciliter or more in the workplace should be considered for removal from exposure based on certain medical conditions. And in 2017, Florida, based on the same effects, Florida proposed, or the Lead Poisoning Prevention Program in Florida proposed, to amend the statutes 381.983, 381.984, and 381.985, because the guidance on what level of lead in blood is considered elevated had to be changed. The last time it was updated was in 2008. So in 2017, these changes that were proposed by the department became effective. And in 2017 also, the Centers for Disease Control and Prevention announced the availability of a new grant to support childhood lead poisoning prevention activities that include reducing lead exposures, reporting blood lead data to the CDC, blood lead testing, blood lead surveillance, and targeted population-based interventions. The lead program applied and received funding for the operation of a surveillance grant. And in 2021, since we've been established with funding from the CDC, again in 2017, we have successfully completed one cycle of funding, and in 2021, we have started a second round of funding of a 5-year grant cycle that runs until 2026. So, looking at the reporting requirements, based on the adverse effects, as I mentioned earlier, that are caused by blood lead levels less than 10 micrograms per deciliter in both children and adults, in 2017, the Lead Poisoning Prevention Program proposed changes to amend the Florida statutes, that is 381.982 to 381.985. And in these changes became effective in 2017, and they include, that is, when you look at the first statute, 381.983, the definition for what defines an elevated blood lead level was changed. It was earlier 10 micrograms per deciliter, and now it was lowered to define as a 5 microgram per deciliter. So, and then changes to the next Florida statute, 381.984, the program revised language that enables more flexibility in terms of how the department will provide educational materials to the public. For example, they will be providing them via the internet and to partners and other stakeholders upon request or as needed, rather than just offering printed materials as the program used to do earlier. And the next change, that is to this change, Florida Statute 381.985, the statute clarifies how blood lead screening results should be reported to the affected individuals. And the Florida Administrative Code 64D3 indicates that healthcare providers, laboratories, and any other point of care testers out there are required to report all blood lead levels to the Florida Department of Health. That is, it also includes to say blood lead levels greater than equal to 5 micrograms per deciliter must be reported to the Florida Department of Health by the end of the next business day, and blood lead levels less than 5 micrograms per deciliter produced by on-site blood lead analysis devices, such as the LeadCare 2 machine, must be reported to the Florida Department of Health within 10 business days. So looking at the state risk factors, now what drives us as a program, to function, all over the state? It's based on so many risk factors that affect the population, especially children less than 6 years old. Now, Florida is the third most populated state with a population of 21 million people. We have 1.3 million children less than 6 years old. Children less than 6 years old are usually the most vulnerable population towards lead poisoning. In addition, in our state, we have over 15,000 refugees, as of 2018-2019. Now, these data, this was the latest data that I was able to obtain to be used for this presentation. And over 11% of Florida's children less than 17 years old are foreign born. Now, that's another population that are vulnerable to lead poisoning. And then in the state, we have more than 1 million homes built before 1950. We have an estimated 336,000 children less than 5 years of age living in poverty. Moreover, we have battery recycling plants that are located in South and Central Florida, which contribute to take-home lead poisoning in these populations. In addition to all these, we also have secondary sources of lead exposure due to the diverse populations that live in our state. When I say secondary source, I'm talking about, imported spices from other countries, which can be contaminated with lead, as well as, home remedies, Ayurvedic medicines, and even some toys that are imported into the country, because none of these products are regulated by the FDA. In addition to all this, we also have a large low-income minority populations, and we have substandard homes located within the state that are a contributing factor to elevated lead levels in children less than 6 years old. Now, giving you a brief overview of the program, the Florida Lead Poisoning Prevention Program monitors lead testing and tracks the occurrence of lead poisoning cases across the state. The program promotes lead screening and provides guidance to county health departments to conduct case management and reduce exposure to all lead hazards. The county health departments primarily are the ones to conduct investigations. By policy, the lead poisoning prevention program is required to have a designated case manager in each county. The state health office here in Tallahassee provides guidance for case management process when needed. Case management process is outlined in the department's guidance to surveillance and investigations document. Now, this document is a handbook for all investigators who are employed by the Department of Health, and it details steps in case investigation, like testing, case data entry guidance, and educational information on how to further prevent lead exposure. And case management, includes a referral to the child's healthcare provider, the environmental investigator, and also the case managers refer children who are affected by lead and their families for early intervention services or special educational services when appropriate. And the Florida Department of Health revised our case management guide in 2020, and it is available on our website for further reference if needed. Now, what are the screening requirements that we have in the state of Florida? So, first of all, children enrolled in Medicaid are considered as a vulnerable population for lead exposure. Children aged 12 and 24 months are required to be screened for lead. That is mandatory. And any child between 24 and 72 months with no previous record of screening have to be screened for lead. Now, another vulnerable population that we are looking at are refugee children. Now, the requirements for this population include children aged 6 months to 16 years should be screened upon entry into the United States. Screening then again should be repeated 3 to 6 months after placement in a permanent residence, regardless of initial test results. And in addition to all that, additional screening should be strongly considered if children are less than 6 years and not previously screened, and they live in a house that was built before 1978, or in a high-risk zip code where pre-1978 house is prevalent. If they're either enrolled in WIC or Head Start, or have to have a known history of lead exposure after 2 years of age. And, if they have a sibling or a playmate with lead poisoning, or if a parent requests for testing for lead, or if these children exhibit neurodevelopmental disabilities or have a history of ingesting non-food items or exhibit pica behavior, that is, eating substances with no nutritional value such as chalk, paint, hair, etc. So now how is it that how do we conduct the case coordination in the state of Florida? Now, based on the increase in blood lead levels of interest and, due to the lack of resources, investigating lead poisoning cases with a blood lead level greater than or equal to 5 micrograms and less than 10 micrograms is entirely optional. However, it is mandatory for lead poisoning case investigators to investigate lead poisoning cases with a blood lead level of 10 micrograms or greater. Case coordination process includes the process of providing and overseeing services such as assessing environmental risk factors, interviewing household contacts, looking at their occupational status, looking at the child's eating habits, the child's behavior, the child's health status, as well as the child's housing situation. And the case investigators also provide education on sources of lead, exposure pathways, and also nutrition. They also recommend that household contacts and siblings less than 6 years old be tested. Additional referrals include pregnant women to their gynecologist and children affected by lead to the Women, Infants, and Children Clinic. We provide confirmatory and follow-up testing referrals as well. And we also refer or recommend that the provider consider the child's healthcare provider consider developmental screenings as well as discuss long-term follow-up with the parent or the guardian. And the department in lead poisoning cases where the child has a blood lead level greater than equal to 20 micrograms per deciliter or more, the health department conducts an enhanced investigation, which is required for children, aged up to 16 years. So in this environmental investigation, an EPA certified lead risk assessor will conduct an environmental inspection, and if CHDs or the county health departments, if they need assistance in obtaining a lead risk assessor, they can always contact the state health office for further guidance. Now, these investigators are the ones who come into the child's home and investigate any single source that they can get their hands on with the help of an X-ray fluorescence device to investigate where the source of lead is present in the child's environment. Now, what defines a case? Now, we receive confirmed cases of lead poisoning as well as suspect cases of lead poisoning. Based on the data that we get, this is how we classify our data. So what defines a confirmed case? A person with a confirmatory laboratory evidence, and confirmatory lab evidence is a blood lead level greater than 5 micrograms per deciliter that is measured from a venous specimen, or a blood lead level greater than 5 micrograms per deciliter measured from 2 capillary specimens, or unknown specimens, or a combination of capillary and unknown specimens taken within 12 weeks of one another. And a suspect case is defined when a blood lead level greater than 5 micrograms per deciliter is measured from a single capillary specimen or an unknown specimen. So now looking at the number of children less than 6 years old screened for lead and the number of cases that we have received for lead poisoning over the years. Now we're looking at data from 2016 through 2018, as that is the data that's readily available right now, whereas anything beyond 2018, that is 2019, 2020, are not available for the public yet. So if you look at 2016 and 2017, you will see a jump in the number of cases from 166 to 828. Now, that doesn't mean that the state of Florida has suddenly a lead problem, that all these children who are getting tested are, testing positive for lead. But this is only because of the case definition change that was made in 2017, as I discussed earlier. We decided to lower the case definition for what defines a blood lead level, an elevated blood lead level from a 10 to a 5. Since that happened, the number of cases have shot up to 828. And, that is the new definition for a lead poisoning case moving forward. And on the right-hand side, you can see the number of children less than 6 years old who have been screened annually for lead exposure. Now, we also have disparities of lead poisoning cases in children less than 6 years. Now, what you can see is the disparities between white people, African Americans, and what the Department of Health classifies as other. Now, as you can see, certain populations such as African Americans, as well as other, which we include Asians, Native Americans, those populations under other, they are disproportionately affected by lead than white people. Like you can see the difference in African Americans with the population, quote unquote, other being, the highest. Now, these rates that are depicted are per 100,000 population, and these data are from 2018. Now, looking at lead poisoning cases by their source and county of residence, on the left, we have categorized the number of cases that we have received, in 2018 by the source. And these sources were obtained by conducting case management processes and by conducting interviews by the county health department. And these interviews include, trying to investigate what actually is present in the child's environment that is a contributing source for the child's elevated blood lead level. So as you can see, you have take-home lead, which is a child getting exposed to elevated lead levels because of a parent or a guardian or a family member's occupation or hobby that is, contributing to their elevated lead levels. And glazed tiles, now this is one of it's a common feature in a lot of homes located in southern Florida where the tiles have a shiny surface onto them, and then that glaze contains lead in them. So any children playing on the surfaces and due to frequent hand-mouth activity by playing on the surfaces or simply touching them, and hand-mouth activity after that contributes to elevated lead levels. And we do see, as I mentioned before, secondary sources such as imported pottery, imported candy, and imported toys also being a contributing source, as well as imported remedies. Now, these are secondary sources of lead poisoning in children less than 6. And usually, lead-based paint is the major contributing source for lead poisoning in children. And here, we are only able to detect lead-based paint by doing additional testing of the house through commercial sources or through an X-ray fluorescent device. Now, these data look like there are a lot of cases, but we also have to note that one child, each child reported here can have more than one source of lead exposure. And more than one source of lead exposure can contribute to elevated lead levels in children less than 6. And on the right-hand side, you can see the map of Florida depicting the rates of lead poisoning in children less than 6 by county of residence in 2018. And as you can see, the darker the color, the higher the rate. And these counties are the ones that detect high levels of lead poisoning, like Miami-Dade, West Palm Beach, and all those places usually have higher. Orange County, Hillsborough are one of the counties where highest levels of lead are usually present because of the substandard homes located in these counties. And in addition to that, we have the lead recycling factories and lead recycling plants that are present that contribute to elevated lead levels in children. And here we have some program resources that we usually provide should somebody from the public or healthcare provider, is looking for any information on lead exposure or lead poisoning or how to prevent lead poisoning. Now, the Department of Health has a lot of information on lead poisoning in children and adults. And we on our department's website also include additional information on high-risk zip codes, basically indicating which zip codes in the state of Florida are known to have homes that were built before 1978, which is one of the most prominent risk factors for children residing there. And children residing in those zip codes are usually, known to have elevated blood lead levels because of their exposure to lead-based paint. And in addition to that, we have information for caregivers. We have additional educational materials for parents and caregivers for little children. And you also have the screening and the case management guide with additional clinical information required for healthcare providers should they need more information on how to clinically treat children exposed to elevated blood lead levels. And also we have links that do, for the CDC have additional information in addition to what we have provided on the department's website, and also for contractors and renovators who are looking for what rules and regulations that one should follow while renovating a property that was built before 1978. So we have all these links available for the public to, refer if needed. And if you have any questions, please feel free to ask me or email me or contact me, whichever method seems convenient. So That's all I have.
Thank you, Sudha. That was great. A lot of information. I really appreciated the concise way you were able to present all of that. So thank you very, very much. So we're gonna go ahead and introduce our next speaker, and then we'll save the questions for the end. So let me share my screen here. Okay, so here we have our next speaker. We're excited to welcome Dr. Elizabeth Fernandez, a general pediatrician and assistant professor in the Dr. Kiran C. Patel College of Osteopathic Medicine at Nova Southeastern University. She was born and raised in South Florida and completed medical school at Edward Via College of Osteopathic Medicine and a pediatric residency at Salah Foundation Children's Hospital at Broward Health Medical Center in Fort Lauderdale, Florida. She is most passionate about well child visits, especially newborn visits, and helping mothers on their breastfeeding journeys. So I will now pass it over to Dr. Fernandez.
Hi, good evening, everyone, and thank you for joining us tonight. Sudha, that was a wonderful presentation, so thank you. Let me go ahead and okay, I think that's good, Daisy, like that. Okay, perfect. So as Daisy said, my name is Dr. Elizabeth Fernandez. I am a general pediatrician with Nova Southeastern University. And I'm excited to go ahead and talk about this. So I'm going to be discussing lead in our health, and some of the information that I will be sharing, Sudha did talk about beforehand. So I would try to keep the redundancy a little bit to a minimum. I don't have any disclosures for today. Some things that we're going to be reviewing are risk factors to lead exposure, the health effects of lead poisoning, specifically in the pediatric population, because they tend to be our most vulnerable population when it comes to this. Explaining just how the screening process works, how we manage elevated blood levels, and some tips to prevent and reduce lead exposures in general. So what is lead? It is an element from the periodic table of elements, the heavy metal. It's very soft, malleable, has a very low melting point, and all of that just kind of makes it very easy to extract and use. So for that reason, it's been a very popular metal that has been used truly for past centuries, not just this 21st century. In the past, it was used a lot in, and it still is used in cosmetics, and sinkers for fish nets, and ornaments, and jewelries, and bullets. This dates back to the times of like the ancient Egyptians and Greeks, all of that. Some brief history on lead. So two of the big movements, I guess, that we had here in the United States was removing lead from gas and from paint. So in 1970, Congress passed what was called the Clean Air Act. And around that same time is when we actually had the United States EPA, which is the Environmental Protection Agency, kind of come to formation. At that point, there was where the big push was made to remove lead from gasoline, when we started to realize how all of that lead in the gas and all the auto emissions that were kind of in the environment were affecting our population. And by the late 1990s, we were able to completely ban lead from being used in fuel. And so you'll notice the unleaded and leaded kind of when we were in the switch. And then also in 1971, we had our Lead Poisoning Prevention Act. And that's around the time where we started to make the movement from removing lead from paint. And so as Sudha had commented on, 1978 is kind of our big marker where we're talking about potential risk factors and lead exposures that could be occurring, whether or not your house was built before or after that date. Since homes that were built before that may still contain lead-based paint if they haven't had renovations done, or if that hasn't been professionally cleaned out of the home, whatever it may be. So just something to really consider. And you know, lead was just really cheap, and that's initially why I was using gas, and it ended up being very washable and durable when mixed with paint. And so for those reasons, it was very popular to be used in both of those substances. The lead exposure in the 21st century. So children are exposed in a variety of ways. The primary source continues to be ingestion of lead containing dust. And so it kind of takes us back to if the homes were built before 1978, if they happen to be near industrialized sites that maybe still use lead, So all that dust kind of collects in the home. And as you may or may not know, children love to put things in their mouths, especially babies. They love it. I have an 11-month-old. His hands are constantly in his mouth. And so other exposures could be a pregnant mother who has elevated maternal blood levels, breastfeeding. If there's elevated levels in the breast milk, it can transfer to the baby. Food, water, some parental occupations, kind of depending what they do, and we'll get a little bit into that later. Toys, cosmetics, herbal remedies. And in many low-income developing countries, lead continues to be used in gas and in other industries pretty much predominantly in comparison to here. And so sometimes we really have to consider that when it comes to imported items that may not have the same kind of regulations we have here in the United States. So definitely something to think about. So exposures, this is just kind of prenatal exposures. So as you can see, if the mother has some risk factors. So for example, sometimes pregnant women have pica, right? Which, as Sudha said, is kind of when you eat things that have no nutritional value, and it could be honestly a wide variety of things. So if they have that, if they have an occupational exposure while they're pregnant, if they're using alternative remedies or cosmetics, if they're using maybe the traditional lead glazed pottery, maybe to hold their food or their juices or their milks, and then they're drinking from that, all that food can now have a lot of lead. And so a lot of these mothers can sometimes kind of contain that lead into their bones. And during pregnancy, you tend to have a lot of bone turnover, which is why we always recommend that mothers take their prenatal vitamins, because babies like to deplete their mother of a lot of minerals and vitamins. And so there's a lot of bone turnover that happens, and that in turn can then leak into kind of the blood of the mother, which then, transfers to the baby through the umbilical cord, and breast milk is also made from the blood of the mother. So those are kind of ways that infants can get exposed to, fetuses, and then later infants can be exposed to lead through the mother. And so mothers should be screened. They should have kind of like a risk assessment performed in their prenatal visits with their OBGYN, and depending on what kind of information comes to light during those risk assessments, they should then have a lead screening level performed on their blood. And so anything that's above 5 micrograms is considered significant maternal exposure, and those moms should continue to have lead levels tested during pregnancy, after, and then the infant should also be tested as well. And so continued. So like I said before, paint, right? That used to be a thing. We no longer have paint that contains lead. However, any home that was built before 1970 may still have that lead-based paint inside the home. And then dust, it tends to accumulate mostly around windows, because you tend to open and close them often. Maybe not so much here in South Florida because it's hot, but I know sometimes when the weather drops to about 60 degrees, I'm opening my windows. And so because of that constant mechanical disruption, more of that lead containing dust may accumulate around windows and windowsills. So soil, so automobile exhaust, not so much anymore because we've removed lead from gas. But it is something to consider in other countries that are maybe transporting food that's later getting imported to us. So there might still be some industries and like battery smelters that are using lead products that can then seep into the soil. And so children that maybe live by these areas and or who are often playing outside, they're maybe in the soil, touching the soil, eating the soil, those are all at risk. Water, so most concerning would be homes that have copper plumbing that is then joined with lead solders, so not necessarily lead pipes, but copper ones that are then joined with lead, those would be at most risk. And so sometimes it's hard to know what kind of pipes are in your house, or maybe it's not an option to redo all the piping in your home. That I'm sure is a very large expense. So some of the things to kind of consider is you can get a filter that you know would filter out the lead, or consider running water for approximately 10 minutes, especially that first morning water run that you're going to do, where water has had a chance to sit in pipes overnight when everyone's asleep. Definitely letting it kind of run for 10 minutes or so to rinse out the lead. And again, food, so grown in lead containing soil, or maybe something that's been imported. So it's really important that we're always washing our food, especially our produce. So children, products and toys. In 2008, there was a Consumer Product Safety Improvement Act that happened, and that was an act that was kind of a push towards improving the safety of our toys for infants and toddlers. So there's a lot of different things that this act kind of, compromises. I'm not really going to go into all of that, but there's a lot of different testings and certifications and third-party testings that are performed on different toys, and honestly, childcare objects in general, such as car seats, lunchboxes, bibs. It's not just toys, to ensure that they have acceptable levels of lead or lower, or that they're void of it altogether. So that was something that occurred in 2008 to kind of help improve and reduce our lead exposures, especially with our children. So how is it that lead affects our health? So it affects three major organ systems. Most importantly is our central and peripheral nervous systems. So that's our brain and our nerves. This is most concerning for children, and I'll get into more of that in the next slide. It also affects our heme biosynthetic pathway. So what that means is how we make our hemoglobin. And it also can put you at risk for hemolysis, which is the breakdown of red blood cells. Anemia caused primarily by lead poisoning is actually fairly rare. Iron deficiency anemia is way more predominant here in South Florida in the United States. However, if you are iron deficient, it can actually put you at risk for lead poisoning. Kind of just makes it easier for your body to absorb lead. It can affect our renal system, which is our kidneys. It can also affect our gastrointestinal system. You may have some abdominal pain, some vomiting, some constipation, and our endocrine system, just because it interferes with how we form active vitamin D, which in turn affects kind of our absorption of calcium. So usually those two go hand in hand together, and so therefore leading to interruptions in tooth and bone development. So our neurologic effects of lead poisoning. So children in particular are very susceptible to toxic effects of lead. They have incomplete blood-brain barriers, and that usually doesn't improve until after about 6 years old or so. And so it makes it very easy for things to transfer from the blood kind of to the brain and the nervous system in general. They have a developing nervous system, right? It's a very immature nervous system. The younger you are, the more susceptible. Like I said before, there was a greater prevalence of iron deficiency anemia in general in children, especially in milk drinkers. That tends to block the absorption of iron, giving you anemia, and that in turn can promote absorption of lead via the GI tract. And in general, like I kind of said before, children love to put things in their mouth. Young children, young toddlers love to just, everything's in their mouth all the time. And so these children, they're crawling all over the floors, they're crawling all over outside. They have a lot of that hand to mouth behavior. And in general, children just have increased respiratory rates, which are normal. So like you and I may breathe somewhere around 12 to 16 breaths per minute, whereas a child may breathe anywhere between 20, 24, 28 breaths per minute. And so because of that, they have the chance to inhale more of that lead-containing dust. And so some of the neurologic effects, it can affect cognitive and behavioral development at really high levels, typically above 100, 150, although it can be less than that, but typically at really high levels, you can see what's known as acute encephalopathy. And so what that means is you might see altered mental status, you may see abnormal gait, persistent vomiting, seizures, and it may even go all the way to coma. It can cause hearing loss, and that can contribute to learning and behavioral problems if we're not catching that hearing loss early on. And we just think, oh, this is a child that just doesn't listen, right? And it's actually because they can't hear. They didn't listen, they don't follow instructions, all of that. And peripheral neuropathy. This is actually more common in patients with sickle cell anemia, which is important here in South Florida because we actually have a very large sickle cell anemia population, both children and adults. And so I kind of like this table because it gives you the wide spectrum of symptoms, right? So low exposures, these patients may be asymptomatic and they have things that kind of may or may not send out. Maybe a little bit lower IQ, some cognitive issues. You may not catch, but maybe they have some issues with memory. They may start to exhibit maybe some signs of hyperactivity, things like that, all the way to if you have high exposures, you have those more serious things, right? The encephalopathies, maybe some paralysis, kind of more serious issues. So risk assessment questionnaires. So as Sudha had said earlier, we actually begin these questionnaires with our patients at 6 months, and we do them through 6 years of age. We do them at every well visit. So well visits in our clinic begin at newborn visits, and then we do 2 months, 4 months, 6 months, 9 months, 12 months, 15, 18, 21, which a lot of people don't make it to for whatever reason, 24, 30, 3 years old, and then annually after that. So we start at 6 months through 6 years of age. So we're honestly kind of assessing the risk of our patients fairly often if they're making it to these well visits on time. And like it was previously mentioned, the CDC and the AAP recommend all children who receive Medicaid, and I think it's actually required, to have the blood levels assessed of children at ages 12 months and 24 months, so 1-year-olds and 2-year-olds. And so some of these questions that you can see here in the questionnaire, the first one starting, do you live somewhere that was built before 1978? Was there any renovations that occurred recently? So if a home is not properly renovated, that could actually put you at risk for increased lead exposure. What kind of occupations does the maybe primary adult in the household do? Kind of assessing if they do have lead exposures with their work. So talking about candies and cosmetics and jewelry and imported ceramic, all of that, like was said earlier, could probably have lead in it. And then all the way to, has this child visited or lived in another country for an extended period of time, because as we learned earlier, lead levels tend to be higher in developing countries especially. Things are just not as well regulated as they are here. So screening process. So the American Academy of Pediatrics recommends beginning the risk assessments at 6 months of age, like I just said. And then we begin screening between 12 and 24 months of age. And so we screen because not all children will exhibit symptoms, even having elevated lead levels. Sometimes they're asymptomatic at very high levels. So we want to screen them just to kind of get a baseline. So it can either be a finger stick, just done in the clinic. That's what we do at the clinic that I'm at. We just do a finger stick, or you can send for a venous sample. So a finger stick, if anyone's ever checked their blood sugar or had maybe a finger stick hemoglobin test done in the clinic, it's basically that you just do a little prick on the finger, drop of blood comes out, and then you put it either in a tube or the little tab, and then it goes and gets tested, and you have results within a few minutes. A venous sample tends to be more reliable. So if this were to ever be elevated, you would definitely want to follow up with a venous sample. So acceptable levels, right? Recently, this was decreased from 10 to 5 micrograms. Acceptable doesn't necessarily always equal safe. It's just what we're accepting, right? So even sometimes children below 5 micrograms may still exhibit some symptoms. And then, like I said earlier, if you were to be above 5 micrograms, you would want to confirm with a venous sample. And so management for kind of any curious people and or healthcare providers out there. So if you do have a detectable lead level that has been confirmed, less than 5, you want to make sure that we're really optimizing the nutrition in that child, right? Making sure they get adequate intake of calcium, vitamin C, iron-rich foods. Remember, again, we said if they're iron deficient, it just makes you more susceptible to lead poisoning. And then once again, lead can interrupt kind of active vitamin D formation, in turn interrupting kind of calcium absorption. So you want to make sure that they have good calcium sources in their diet. If someone is kind of optimizing their nutrition, then that'll minimize the risk of them developing pica. So iron deficient anemic patients sometimes have pica. If maybe you've heard of it, they like to eat ice. So it's just, it will minimize that. And so if you're minimizing kind of the eating of non-nutritional sources, and you're minimizing hopefully that child eating dirt or the child eating paint or whatever it may be. And also we want those children to avoid fasting. In general, children really shouldn't fast, but we want them to avoid, because that can also increase absorption of lead. And then you would want to continue to test that child until they're at least 6, maybe more often if they're younger than just an annual blood test. And then you may opt to have kind of a home inspection to detect the sources of lead. If it's anywhere between 5 and 14, we're going to do all of the same things that we would do for the lower, but we would want to do testing more frequently to make sure that this level is not increasing and that it's actually decreasing. And as we get into these higher levels between 15 and 44, 44, 69, above 70, we start to do some kind of more vigorous assessment, I guess, management on these patients. So, we want to confirm sooner. We would want to test often. We would want to potentially maybe get x-rays and consider doing a whole bowel irrigation depending on what shows up on x-rays. Sometimes lead kind of fragments can light up on x-rays. If they're really high, then we would want to confirm within 24 to 48 hours. And at this point, we would actually consider chelation therapy. So these patients that have levels between 45 and less than 70, they are candidates for chelation therapy. And they would actually get additional testing to look at their electrolytes, their liver enzymes, iron studies, urinalysis, and other heme studies. And these patients would be hospitalized. And the ones above 70, absolutely. You would want to confirm a test probably that day, if not within 24 hours. And more than likely, you're sending them to the ER to get these results as quick as possible. And so chelation therapy is where a synthetic solution is injected into the bloodstream, and that's a way to help remove heavy metals and other minerals from the body. Oh, and in case I didn't point this out, this is lead levels in asymptomatic patients. So you can have really high levels and not exhibit symptoms. I wouldn't say it's probably the norm, but it can happen. Now, symptomatic patients, that's a medical emergency. So that warrants immediate repeat of lead level for confirmation. So absolutely, hopefully they're already in the emergency room, to be quite honest. And so immediately you would want to confirm it. Once again, we would begin getting baseline studies, including labs and imaging. We would want to stabilize a patient. These patients may become unseizing, or if they have altered mental status, they're unresponsive, maybe they require intubation, whatever it may be. So all of those patients that are kind of just described would most likely be presenting with encephalopathy, and they would require admission to the pediatric intensive care unit just for closer monitoring. Chelation therapy really is life-saving in these children. Avoidance of lung puncture. So some of these children come in altered, and obviously one of the, maybe not obviously, but one of the differentials that we would want to be thinking about is a potential infection like meningitis, because that can cause kind of an encephalopathic patient, an altered patient, a seizing patient sometimes. And so you really only want to do a lumbar puncture if you think it's absolutely necessary. Could two things be happening at once? Sure. But lead intoxication can raise the intracranial pressure. And so if you were to perform a lumbar puncture, that could result in a potential herniation of the brain. So the brain kind of dropping through kind of the hole back here within the body. So we would really want to be sure that we absolutely needed that. And then if it were to be performed, you would want to obtain the most minimal sample of the cerebrospinal fluid as possible to get the information you need. These patients absolutely need the source of lead to be identified, and it needs to be removed from the household or the environment as best as possible. And obviously we need to have appropriate follow-up once these patients' blood lead levels have been reduced to appropriate kind of levels, and obviously their cognitive function is returned and everything. And so primary prevention, is the only way to reduce potential neurocognitive effects. So really minimizing the exposures that our children have to lead. So if possible, we would want to remove lead painted surfaces, contaminated soil, pipes. You may want to actually discuss the elimination of lead sources with expecting parents prior to them even having a child in the household, just to try and reduce those risks right from the beginning. So reduction in lead dust, lead-based paint, removal and replacement of building components is probably the most ideal thing. However, it needs to be done correctly, or else, like I said earlier, it could actually put you at risk for increased lead exposure if some of that is left behind, or if you're kind of disturbing those areas that have lead and then you're not removing it completely, and now you've exposed it to the air. That's expensive, so that's not really an option for everyone. So if you're unable to have it professionally removed, try to really take some very significant dust control measures to try to reduce overall lead exposure. Like I said earlier, water used for drinking and cooking, it should be taken actually from the cold tap, since lead tends to settle more in the warm water tap. And like I said earlier, run that water first thing in the morning for about 10 minutes or so, just to kind of rinse out the lead, if you will, to make that water safer for consumption. We want to optimize our diet, like I said earlier, and we really want to try to avoid purchasing non-brand toys from discount shops, private vendors, or old vintage toys, which may not have been regulated like our newer kind of items are. So those are all kind of things to help prevent and reduce exposures. And lastly, just some general information, because I find that a lot of people here in our kind of Davie City and just South Florida in general don't know that Nova Southeastern University is not only a university, but we actually have clinics and we cover many different specialties. So we have 3 different locations, as you can see here. This is, I believe, just a general line if you want to get an appointment with any of these. I thought I would include it. We see pediatric patients at the main campus, which is here in Davie. I believe they're also seen in North Miami Beach. I just don't think they have a general pediatrician over there. I think it would be family medicine who would see the children there. And I believe in the Miami office, they do more of like neuromuscular kind of medicine. So we don't really see pediatrics on there. But just general information so everyone knows. It is a teaching clinic. We have students and rehab residents. And I always think the more eyes seeing someone, the better. So just to let you know ahead of time. And then lastly, some resources. I know that there's a lot of information on the website, and even Sudha kind of shared some resources, but these were kind of some interesting websites that kind of can give you more information on that. Healthychildren.org in general can just give you a lot of good information when it comes to pediatrics. In general, just aside from lead, but it will give you a lot of good information. And this is my child and this is my dog. So thank you so much for your time.
Thank you so much, Dr. Fernandez. That was really great. And, you know, sitting and watching all these different presentations for me every single time, it just connects the dots more every single time I see all these different presentations on lead poisoning. So we do have a few questions that came in. If you have other questions, please feel free to add them in the chat as we're going through the Q&A. So we have a question for Sudha from Brandon, and he's asking what contributes to the others category experiencing almost 10 times the rate of lead poisoning as their white counterparts? Wouldn't it be helpful to know the individual risk factors for the different racial groups within the others category by assessing them separately?
Thank you for your question, Brandon. When I say others actually, for the data surveillance purposes, we have classified them as other because of, the CDC required data and the format of submission, which is going to be too detailed to get into. But when we say other, these populations are, usually include, populations such as Asians, which again are a broader category for, describing people from different parts of the world. And sometimes people from other cultures are exposed to certain risk factors, such as imported remedies, imported candy, imported, food products that, are contributing factors to elevated levels of blood. And in addition to that, a lot of these populations, unfortunately, when we talk about low income, and high risk, they, usually reside in zip codes that are, denoted as high risk because of the presence of, their residences in high risk zip code areas. And, and a lot of times, in these populations, in addition to the said number of sources, unless we do a completely or a thorough environmental investigation, we sometimes don't even know where the lead comes from. But these populations are more at risk because of, the imported spices, imported products, the secondary sources that are usually present, in their household that are contributing factors for, elevated lead levels.
Thank you, Sudha. As a follow-up to that, do you think in the future they will collect more detailed information about like a breakdown of the others, racial or ethnic groups?
See, Brandon, we have that information available. Depending upon the requester, we usually are able to break it down, but for just surveillance purposes and data submission purposes to the CDC, we have broadly classified them as other. But if usually stakeholders or public makes a request that they wish to see data under certain races, a written request will usually, be processed, but we do collect that data, and one other thing, in addition to collecting that data is not a problem. It is the way the data are reported in order to be able to collect that information. Now, the Department of Health usually has provisions to collect data for a lot of, the races and ethnicities that we usually see in a lot of other reportable conditions or other diseases. But when we get data from providers and other laboratories, sometimes they just don't end up sending the information to us because they themselves don't collect it at their point, and they just report what they have at their end, resulting in us to either classify them as unknown or broadly classify based on the information that we get as other. But we do have them. Should you need something like that, just make a formal request and we can always work with you to give you the data you need.
Thank you, Sudha, for answering that. So another question, this one's for Dr. Fernandez, also from Brandon. So another presenter suggested that chelation therapy can cause the lead stored by the body in bones as a protective measure to flood the blood, and this is a cause for concern in young children. How do you go about assessing the risk when deciding to move forward with chelation therapy?
Sorry, can you repeat the first part of that question?
Yeah. So he mentions another presenter suggested that chelation therapy can cause the lead stored by the body in bones as a protective measure to flood the blood, and this is a cause for concern in young children. So how do you go about assessing the risk?
Okay.
Yeah, okay.
I would say for sure the symptomatic patients, they would want to undergo chelation therapy, but I think with asymptomatic patients, if kind of their other, depending on what level they were presenting with, and how their other lab studies or maybe imaging studies are showing, then maybe you have more wiggle room, if you will, to kind of wait on chelation therapy and see if you can bring it down, if it'll kind of just decrease on its own over time with just close monitoring and follow-up to see, because that is a good point.
Yeah, thank you. Another question from Mercedes. I guess this could be for both presenters. What can we expect in the future, statistics-wise, for lead exposure?
Statistics-wise, in the future, we hope to increase our screening numbers as the year progresses. That is one of the primary objectives, at least for the health department, because we want to be able to screen more children. That is something that the program wants to do a lot more, and hopefully, with the cases coming in, we would like to, see if there are more emerging sources of lead poisoning. That is something that our program would like to, see and detect and be able to offer testing services for these emerging sources, whether it's from, jewelry, tainted jewelry, or imported food products where we have limited sources right now, and sometimes we are unable to offer that to all populations alike. That is something we hope to expand and have more people trained and certified to be able to offer environmental investigative services in order to be able to get to these sources. So that is something that we're hoping. And like I mentioned, for statistics, we are just hoping to increase the number of children that we screen on an annual basis. So anybody out there with high risk, we're able to capture better and then be able to provide primary prevention methods in order to prevent any further exposure in future.
And just to piggy off of that, I think with clinics now having devices within their offices where they can just go ahead and screen based off of a capillary sample, really increases the overall numbers of children that we're screening, because I know oftentimes when we send out our patients for labs, it's kind of a hit or miss whether or not they go and they make an appointment and they go and they do the labs, especially for screening type studies that we're trying to do. And whereas now when we could capture these numbers in the offices, I think it's helping to overall increase how many children we're screening for something like this.
Awesome. Thank you both so much. Any other questions? I know we're a little over time. Well, I want to thank you both so much. Yes, thank you. Thank you, Sudha. Thank you, Dr. Fernandez, for your presentations. I feel like my takeaway was how that, I didn't realize that, yes, we've banned lead paint and lead gasoline, but we do export many products, and that could still be a risk. So it's definitely something that was more clear to me, listening to the presentations and to being more careful and more aware. So thank you so much, both of you. So I'll just close off the session here with a few notes. Let's see. So as it turns out, this week is National and International Lead Poisoning Prevention Week. So you will find more information on our resources page on our website. Also a little plug for the NSU Alvin Sherman Library, who's one of our partners in promoting this web series and virtual exhibit. If you live or work in Broward County, you can apply for an Alvin Sherman Library card. It's free and you will have access to many resources and get notified about events and programs like this one. And finally, again, a big thank you for all of those who attended, those who kind of stayed on a little bit longer. A special thank you to our guest speakers, as well as committee members who helped organize the event. And please visit lib.nova.edu/lead for information on upcoming events. Thank you so much.
Thank you, Daisy, for hosting a great event today.
Thank you.
Thank you, Daisy.
Thank you,
Thank
Sudha.
you so much.
Have a good night, everyone.
Have a good week. Thank you. You too.
Bye-bye.
Bye.